Okay, hello. This is Sasha from the Coalition on Homelessness. I don't unfortunately have a camera on my screen, but I am here in spirit and I'm happy to see all of you here with us. I'm gonna start with a little bit of our Zoom logistics, as this is our second Zoom coalition meeting and it's already significantly larger than our January one. So we're very happy to see that this is an option for all of you. I am the administrative coordinator with the coalition. We of course have Jason and Allison with us, and then Hillary is on the call as well. And we have coalition in our names that you can see. And so, again, if you're using a computer, thank you so much for everyone who's entered their email in the chat. If you haven't entered your email, if you could please do that so we can ensure we know that you're here and we can send the follow-up email. If you're using a phone, we would love if you are able to email Jason to let him know that you are on this call, and you can reach him at jason@homelessinfo.org. At the moment, we currently have everyone muted, and that is to help us focus the conversation as we are presenting, and we do actually have a lot of guest presenters during this call. And so Hillary and I are going to be trying to manage appropriately unmuting our presenters when it gets there. But we do want to hear from you, and we do want to have a dialogue as opposed to a Q&A. And so at the moment, there is the ability to raise your hand, I believe. And so if you're able to raise your hand, we will unmute you and then be able to connect with your question or comment. And then additionally, we right now will not be answering questions that come into the chat, as we do have, as we usually do, a packed agenda. So we will be monitoring the chat and keeping your questions to refer to. However, we encourage you to ask questions, share resources, connect with one another, but know that we're not going to be monitoring the chat for questions in the moment. But if you can unmute yourself and ask the question at that time, we'll do it that way. And the last thing is that after this, we'll be sending a feedback survey as we are trying to make sure that the Zoom call is effective for everyone. And so the logistics of the Zoom. So we encourage and welcome any feedback from that. So you can look out for that either in this chat or in email or both. So, yes.
Okay. Sasha, this is probably a good opportunity to let folks who are on phone only know how they can send a note if they have something to say and they're not able to enter it into the chat.
Yes, if you would like to email us, you can, Hillary and I are accessing our email right now, so you can email us at either sasha@homelessinfo.org or hillary@homelessinfo.org, and that will be the best way. You can also, I think, when we get to like unmuting conversation, *6 is how a phone will unmute themselves, and we will ask phone people first if they have any questions, and then move to folks who we can visually see to help with that transition. Yeah. I will pass it along then to Allison and Jason. So thank you all.
All right, thanks, Sasha.
Thank you. All right, good morning, everyone, and welcome to our March General Membership Meeting. We typically host these at a community space in the Southside Commons. For the time being, we will be hosting these remotely. My name is Jason Austin. I'm the membership organizer here with the Coalition on Homelessness. The agenda for our meeting has been posted on our website. Hillary put the link to the blog into the chat box. For those who don't know, our website is homelessinfo.org. You can get a brief overview of who will be joining us and what we will be discussing. As was mentioned earlier, we are attempting to be as flexible as we can, given that we have a high number of presenters who are themselves extremely busy and may be pulled into various meetings at points over the next 2 hours. So check the agenda online with an understanding that we may sort of flex that a little bit, and we appreciate your patience. We here have been given a crash course in how to conduct conference calls. We really appreciate your patience as we get this together, and we will attempt to replicate what we typically do at our meetings here. We do still want to foster conversation and a sense of community here. It's going to take us a little bit of adjusting to get used to all this, but I think we will still be able to accomplish the same things here. Now, before we launch into the content of our meeting, we want to sort of take a moment and kind of center ourselves a little bit and sort of begin with the grounding exercise. Allison, would you like to lead us in that real quick?
Right. Good morning, everybody. So as those of you who have attended our meetings in person know, we usually begin with introductions, which you've done in the chat box here, and with refreshments and really a chance to be together. And since we're doing those things virtually and we're under really significant stress in our community and in our work, I wanted to borrow something from our friends at the Healthcare for the Homeless Network. I think everyone has gone through many different stages of adjustments, and we've got many more ahead of us. I want to particularly acknowledge that for people who are engaged in providing direct services, life-saving services, survival services, housing, for people experiencing homelessness, and for people who have themselves been through traumatic experiences like homelessness or war. These are exceptionally difficult times, and we are really, really committed to helping to sustain each other and to counter the kind of stigma and, in some cases, racism and fear-mongering that are happening sometimes from elected officials at the highest level in the land and sometimes in our community. So we need to figure out how we are going to be in this for the long haul. I think everyone on this call already knows how to do that really well, but we're just going to have to ratchet it up. So I'm going outside my comfort zone to just borrow something from the Healthcare for the Homeless Network team. And it's simply just a few minutes of inviting you, if you want to close your eyes if you wish, and take a few really good deep breaths and use your brain and your imagination to picture a beautiful landscape that's familiar to you, or a sunset or sunrise, or think about a beloved pet or a person in your life, and just take a couple of really good deep breaths, holding that image in your mind. Okay, so probably you are not getting enough sleep. Probably you are worried about people that you love who are far away. Probably you are concerned about the people you work with and for. And I do have to say that myself, as somebody who is not very far along the self-care spectrum, I have been pretty amazed at what just pausing to take a couple of deep breaths can do in the course of a pretty stressful day. So I invite you to think about doing that for yourself if you can. Usually we read our mission statement, and I want to just very briefly share with you both our current mission statement and our work towards where we're going with that. So as you all know, our mission for many years before I came to the coalition has been that we work collaboratively to ensure safety and survival for people while they're homeless, and to end the crisis of homelessness in our community. we have a lot of things we all love about that mission statement, and we also know that we feel like it's not quite where we need to be in modern times. And I want to say that we're going to be rolling out our new mission, vision, and values to all of you. The board is going to formally adopt those probably in April, but it seemed like a good time to give you on this meeting call today a little sneak preview of our new mission statement, which is that we mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. And our vision is a region that acts on a shared sense of responsibility to ensure that everyone has a home. I think that the experiences we've been through in the last 2 to 3 weeks in this community remind us that we need to worry about people while they are experiencing homelessness right now. And thanks to each and every one of you who is engaged in doing that. And we are never going to stop fighting for the housing that people need. There is nothing like a global pandemic to remind everyone that our collective health is dependent on everyone having good health and what they need. And these are difficult times, but there's also really exciting and important work happening. So I'm really grateful to Xochitl from Washington Can and some other folks who are going to be joining us later. The legislative session seems like a lifetime ago, and yet significant things were gained in that session, thanks in part to our advocacy. So Representative Nicole Macri is going to join us a little later on, along with Michele Thomas from the Washington Low Income Housing Alliance, and our friends and members at the Child Care Resources. And then of course, as I think everybody is aware, first the city of Seattle, then King County, and now Washington State have some form of eviction and foreclosure protections, moratoriums in place. So Xochitl is going to help unpack those for us. We want to start, I'm not sure whether or not I see Jody Rauch on this call. So it looks like.
Jody, I just unmuted you.
Ah, very good.
Hello, I am here.
Wonderful. Welcome, Jody, and thank you, Hillary. So it's really a great pleasure to have Jody join us. Jody has been to many coalition meetings in person, and we always knew that she was a wonderful addition to the work in this community. But I would say for the last 3+ weeks, we have learned what an incredible treasure and asset she is to our community. So Jody, I want to thank you so much. I know there's very important information that you're going to share with people, and we'll just be listening and watching in the chat in case there are key questions that come up. But Jody's going to cover some of the resources that I hope you all are already aware of, as well as some things that are new.
Thank you, Allison. That was very kind and very appreciated. And thank you for inviting me and having me here. We are wanting to get this information out to as many folks and in as many hands as possible. So we are very appreciative for being invited back. And I do just want to reiterate Allison's really lovely opening remarks. This is really hard. We were already very stressed. We were already fighting a lot of issues affecting the folks we work with. And now we've got new stuff and it's changing regularly. So just thank you so much for all the work that everybody is doing. We could not do it without you. And please let us know how we can continue to support you, what information you need. I have been very grateful and thankful for all of the really hard questions and the constructive criticism that has been coming up that we can raise up the flag. So please continue to do that. So Allison asked me to kind of go over 3 kind of key things, which is the interim guidance that we've put out, a little bit of an update on the call center, and then a new team that we're working and hoping to deploy next week. So that's what I will plan to cover here in the next 10 to 15 minutes, I think is what I've got. So we have worked very, very closely with our partners at the Centers for Disease Control to really come up with the best guidance that we can based on the information that we know right now about COVID-19, specifically for homeless service providers. Because it is changing and we are updating that guidance as we get new information or things shift, we are asking folks to regularly check back in to the Healthcare for the Homeless website. And that website is www.kingcounty.gov/HCH. That'll take you right to our homepage, where there's a ton of information and resources across the board, but right up in the top right hand, we've kind of got a little box that has all of our COVID specific information for you all. So there's a list of links there, a couple of which I'm going to focus on for you all, but it also links to our sanitation and hygiene guidance. And my colleague, Marta Lema, will also be presenting today, so I'm going to let her really dive into that. But I do just want to say that guidance was developed pre-COVID. So Marta did a wonderful job of developing a 1 or 2 pager specifically on cleaning the environment and disinfecting specific to COVID-19. And that is a link that is listed amongst the list that's in that little box on our homepage. And Marta will dive into that in much more detail.
Actually, Jody, I don't want to interrupt you, but I just want to say on our agenda, we didn't actually give Marcia time to dive into that because we anticipated most of our service folks have already been on those calls. But we will assess when it's Marcia's turn whether or not people need a little bit more time than we've currently allocated on the agenda today, since she and her team are doing a great job of additional call opportunities.
Wonderful. Thank you for that clarification.
Sure.
And as Allison just referenced, every Tuesday and Thursday from 11 to 11:30, Marta and I are on a call together, really helping to dive deeper into those questions, so that there is ample opportunity, and that will just continue to be a standing call moving forward. If we need to extend it to more time, we absolutely will, to accommodate folks' needs. So thank you, Allison.
Thanks.
So in terms of the guidance, this is going to look really different across a lot of different sites, and we know this. So what Public Health in King County is asking folks to do is to do their best to meet this guidance and implement it where and when you can. And then please call in if you're having trouble or you're not sure if what you've come up with is the right solution, or you need a little extra help. We are absolutely more than happy to do that. The best way to direct those specific questions is either on those calls that I just mentioned, or you can email us at COVID homelessness response, all one word, at kingcounty.gov. That is an inbox that's being monitored daily. It's being answered with stuff that's already, information that's already been approved. And then if there's something else that comes up, it's being forwarded either to environmental health or to myself or housing folks. So that is another resource for everybody. The big thing is social distancing that everybody has heard so much about. We are asking folks to do whatever they can to create at least 6 feet of space in between folks. We know that creates a tension. When you spread folks out, that means less people come in. And that is a balance that we're really trying to strike. And we've worked really closely with the county to provide extra spaces to sort of de-intensify a lot of the shelters that has already happened, and making sure that some of the most vulnerable in the shelter system have been moved out and away weeks ago. We're starting to do that as well with the day centers, because we know that's become a pretty big issue with the libraries closing, and as more people are seeing staffing constraints, that this is becoming a bigger issue. And so we are very much aware of that. We're working with the city to help with this. So in a shelter space, what that looks like is some agencies are going to be able to they have multiple buildings, and maybe they're able to actually dedicate a building to people that are feeling sick. And folks that are not feeling sick and don't have symptoms and are still feeling pretty healthy can actually just be in a whole separate building. Regardless of where your folks are, we want everybody, if they're sleeping, to be at least 6 feet apart. Beds, mats, cots, we want them 6 feet apart, and we want them in a head to toe an arrangement. Much better to be possibly smelling your neighbor's feet than being coughed on is what we would like to spread that message for. Another suggestion that is coming straight out of CDC, and this depends on really what kind of resources you have and what your setup is like. I've seen some places that do a similar thing. If you're able to put up curtains, shower curtains, sheets, to create just a temporary physical barrier between beds, that's also just another tool that can help reduce the spread. Right now, our current thinking is that this virus is primarily spread by droplets. And again, pay attention to changing information as it's coming in all the time, but that's the current thinking, that it's primarily spread that way. So droplets are the stuff that comes out of our bodies when we cough and we sneeze, and just generally, or sometimes laughing or singing or talking. If we've got stuff we're expelling out of our respiratory tract, the droplets are a little bit bigger and a little bit heavier, so they don't hang in the air as long, they don't travel as far. So that's where that distance of 6 feet really helps reduce your risk. We know that there is a mask shortage, and there's all kinds of work being done around just even getting healthcare providers that are doing direct patient care with confirmed positive folks not being able to get all of the right equipment that they have. If you do have access to just basic surgical masks or tissues or anything that can help kind of contain the droplets for folks and covering those coughs and those sneezes, that's really helpful. Does need to cover the nose and the mouth. And then incredibly good hand washing, like just upping our hand washing. Soap and water is ideal. Scrubbing all those nitty gritty areas, in between our fingers, around our wrists, cuticles, under the fingernails, all of that for 20 seconds. Hand sanitizer is a good option if you do not have access to soap and water, or your clients don't have access to soap and water. We do want at least 60% alcohol level for that. That is what is recommended. And it is not going to work as well if hands are visibly dirty, but it is better than nothing. So just wanted to put that out there, and we're really trying to provide guidance that is kind of coming through, more or less a harm reduction lens of like, this is ideal, but if that's not going to work or not a possibility, here's the next best thing. So if you have a separate room in a building where you can put people that are feeling sick, that's the next best thing, as opposed to just moving them to a totally separate location. And again, separate bathrooms are ideal, and then really keeping folks out of any kind of communal eating area, bringing food and drink and water to them is really helpful. If you don't have a separate bathroom, really increasing the cleaning after high touch areas and disinfecting after people that have been ill have used the bathroom. And it is not lost on me that this requires a whole lot more monitoring and staff and work. So I just want to acknowledge that. And then if you have just a large, well-ventilated room where you can kind of sort of have one side be for folks that are not feeling sick and another side where people are feeling sick. And again, really just creating as much space between those two groups and then within those groups is really key. Providing anybody that's feeling sick with some tissue, some hand sanitizer, a plastic lined wastebasket so things can go directly into the waste paper basket, and then hand hygiene can happen right after. These are all really good things that we can do. One of the other things that is on the website is sort of how you might care for someone, or things to watch for if someone has symptoms that are consistent with COVID. and we've put it up as COVID, but this applies really to almost any illness that someone might be having, because we still have hepatitis A out in our environment. We're still in flu season, colds. You know, you are not going to necessarily know that the person in front of you has just allergies, or this is a flare up of their chronic, you know, COPD, or if it's COVID or flu. So we're not asking you to know that. We're just these are all good basic infection prevention that is going to help with all of those things. But this document on how to care for folks, it kind of just goes through the common symptoms of COVID and gives you a little bit of a better sense of like what those things are. A few tips around cough, around fever, and then really severity of when you need to call 911, and then just good tips on how to monitor, being looking for things like dehydration and how to combat that. It goes into a little bit of folks that may be using substances or alcohol and complications that might be coming from that added piece that may affect their health. And on this guidance, I just want to also make note that I think we as a community have done a really great job of kind of taking to heart, not overwhelming 911, not overwhelming our emergency room systems. And that is still true and good advice. The folks that we're working with, they are at higher risk. And so if someone has mild disease, which what we know is that most people are still going to have mild disease, and that starts to get worse, especially in our folks that are higher risk for all kinds of reasons, that is a reason for them to be seen by healthcare providers earlier and sooner rather than later. So if it's something that you would normally call 911 for, that is still appropriate. Our folks are at higher risk. If you do end up needing, I do want to make just a note on testing, because that comes up a lot on these calls I'm talking about. There is a ton of work that's happening this week around testing. I do not have a whole lot of information to share around that, other than more sites are coming online soon. And in this moment, we're still asking if you have somebody that has a primary care doctor, or you feel they need to be seen in an emergency room, to call ahead and let them know that you are concerned about COVID, so they can take the precautions on their end not to spread to other folks.
I'm sorry, Jody, this is Allison. I just want to do a little bit of a time check with you. This is really useful, and I also want to make sure that you have time to talk people through the hotline phone tree changes and the FAST team.
Yes.
Okay.
I'm moving on right now.
Great. Thank you so much. And just so everyone knows, we can see probably about 25 of you and your smiling faces on our screen, but we're close to 100 people attending this meeting virtually. So if we can't see you, Hillary and Sasha are monitoring the chat box. They entered their emails there. And I also just want to let everybody know that we do have reporters who are attending our virtual meeting. So welcome to the folks in the media. We have a lot to cover. So as much as possible after Jody and Marta have spoken, depending on when Leo joins us, I'm going to try to have time for a few questions and to give you some updates that I have. But back to you, Jody.
Thank you. So to the phone line, we do have a COVID hotline. This is where we're asking anybody that has any questions about COVID, and particularly if they have someone that they are concerned about, to call in. That number is 206-477-3977. The current setup right now is that the wait time is pretty low. I called yesterday actually, and I got right through to a nurse. And if you say you've got someone that you're concerned about who is experiencing homelessness or has experienced homelessness, that is a priority and triggers to get you kind of through to the side of the phone tree where this person maybe needs an assessment by a nurse and then possibly by our communicable disease and epidemiology team. And then they will kind of go through that specific situation and figure out what is needed. Including the potential and possible need for isolation and quarantine spaces. We know we do not have enough of that right now. We are working all the time to bring more and more online with more and more supports to help the people that need it, that maybe need a little bit more medical support or behavioral health support. So I do not have that latest update. I'm not working on that team as intimately, but I do know that they are working diligently to bring all this online and quickly and as soon as possible. But that is the line you want to call. What is coming down the pike and is not live quite yet, and as soon as I have the green light that this has gone live, is we will have a phone tree. And so what will happen is call the call center. There will be an option for you to select you're working in the homeless service field or you've got someone in front of you experiencing homelessness. And then it'll give you the option of like, I've got somebody sick in front of me and I need the nurse line and the CDEPI line, and you can select the prompt to get to that line. But if you just need support, if you think, you know, I don't understand the guidance, I need help with the guidance, I just need to know where it is, I need supplies, you know, you've got general questions, there's a whole other side that will lead you to kind of some prompts. And then eventually we're working on having what we're calling a FAST team, which is a field assessment support technical assistance team. And we're hoping to have this, I just got all my guidance approved last night, late last night, press. And we're working on, so we have our first scheduled FAST visit for Monday. And the idea is that we will be at first targeting some prioritized day centers, shelters, encampment sites, to really go on site with a team that may include environmental health, that may include nurses, to really work with staff at sites to, you've got the guidance in front of you, that's wonderful. Putting it into action is a whole other thing. And so we will be working with you on that. Again, COVID homelessness response at kingcounty.gov is where you can ask for some of that help. The calls on Tuesdays and Thursdays is another place. If your site doesn't quite hit the priority list, and the prioritization, just for full transparency, is really based on a survey that we did of everybody, really having an understanding of how well they were already able to implement the guidance that was coming out and how well they matched that, or how high numbers of folks that were over 60. So that's kind of where we started with a prioritize. If you don't fall into that, that doesn't mean we don't have help or access for you. We will absolutely, through the email, through the phone calls, work with you how we can. So that's coming online, not quite live yet, but next week is looking pretty promising. And so on that note, I will hand it back to Allison. Thank you so much.
Thank you very, very much, Jody. One thing that I want to just ask you to speak to, because this has, of course, come up a few times, is the hours for the hotline and what to do if you're experiencing homelessness or you're a direct service provider and you're in need of that kind of assistance or response outside of the current hotline hours.
Thank you. I appreciate you bringing that up. The COVID hotline and call center is only open from 8 a.m. to 7 p.m. That is 7 days a week. But as Allison mentioned, after hours, that's a pretty big gap in being able to provide support for folks. This is something that we have raised and we are working on and trying to figure out how we can extend that coverage so people can have help. So it is not the best answer. It's not the answer I want to give everybody, but do your best to put masks on the people that are not feeling well, separate them from the rest of the group, encourage really good hand washing. And then as soon as that call center comes online at 8 a.m., calling in and working through and seeing if we can get them placed in some of these sites that are starting to come online soon. And again, I'm just going to reiterate, if you have someone in front of you that you're really worried about, 911 or the emergency room may be appropriate. My understanding is if some of you are able to access the low acuity nurse line, that's still up and running. And that might be another place to get some good advice after hours to help maybe make some of those decisions. So it is a gap. We are working on it. And as soon as we have better resources, we will absolutely let you all know. Thanks, Allison.
Yeah, thank you very much, Jody. Let's see, maybe Hillary or Sasha, if you could make sure that Marta is unmuted because we can't see her in our current configuration. Before I turn to Marta, I'm just scanning the chat box here since you know, Leo Flor, who's the director of the Community and Human Services Department for King County, is going to be joining us in about 10 minutes. So I'm going to ask Marta to speak briefly, and then I'm going to share a little bit of information about what we're doing at the coalition in partnership with our friends at King County and Healthcare for the Homeless and the City of Seattle and all of you. Marta, if
yes.
you, wonderful.
Yeah.
Welcome. Thank you very much.
Thank you so
Marta.
much. Thank you very much. It's nice to finally meet you all, or virtually. I know we've been in contact quite a bit via email, but it's nice to hear your voice and see your face. Good morning, everybody. Thank you so much for having me. I will be quick because I know that we are running a little short on time. So I just wanted to touch on some of the resources that we've developed for folks around sanitation and hygiene. You may already be familiar with our main resource on that, which is the Sanitation and Hygiene Guide for Homeless Service Providers, which was produced at the end of 2019. So as Jody mentioned, that was pre-COVID. So a lot of some of the information on sanitation and disinfection may not be specific to coronavirus. And actually, since we produced that document, we did update the sections on how to sanitize and disinfect. That's pages 21 and 22. Which were also mentioned in a webinar that we hosted a couple of weeks ago, which is online on Healthcare for the Homeless Network's webpage, their main page. That's one of the resources that you'll see there is a webinar where we delve into some of the more relevant information in the Sanitation and Hygiene Guide specific to coronavirus and just mitigating the spread of any communicable diseases. So those updates are online now, and pages 21 talks about how to prepare a daily disinfectant, but that disinfectant is not going to be strong enough for coronavirus. And then on page 22, we go into how to create a disinfectant for hepatitis A, which will obviously address hepatitis A and it will address coronavirus. However, it's a very, very strong solution, and you don't need to be using that every day unless you have a suspected or confirmed hepatitis A case, which is why we created a guidance document, or a handout, really, one or page 2 document that is also on Healthcare for the Homeless Network's homepage that is specific to how to clean and disinfect for coronavirus. So that is online right now. Also in the interim guidance that was created by Jody and her team for coronavirus, there is a link that'll take you to a list of approved disinfectants approved by, that are EPA registered and approved by CDC for disinfecting coronavirus on surfaces if you do not want to be using bleach at your sites, or if for some reason bleach isn't available. So there's a link to that in that interim guidance. And really with all this information, we're really just stressing hand washing, and with the cleaning, just reading the labels, making sure that you're protecting yourselves and wearing the right proper PPE, and that you're using the proper contact time that's required for those products, because that's really, really important. So after you clean surfaces, you want to spray those disinfectants, or if you're using wipes, just leaving that solution on the surface for a certain amount of time, whatever time the product label is requiring, so that it can kind of do its thing on that surface before you wipe it away. So that's really important. And ventilation. Making sure that you are all opening up doors and windows, especially during cleaning, but even when you're not cleaning, just to allow fresh air to be flowing through your sites and facilities while clients are being served. And then back to the Sanitation and Hygiene Guide, we did actually just get a ton of prints of that, and we laminated the poster pages so people can kind of post those up throughout their sites. And I have been in touch with Jason to try to get those binders over to Jason at some point, maybe within the next week or two, so that those can start to get disseminated if possible. Yes.
Marta, thank you very much. We don't have to wait a week or two. We will work with you to make those available starting today.
Okay, so that's great. I'm actually not at the building today, but we can definitely set something up. I'll stay in touch with Jason and try to get some boxes of those binders over to him so that he can start passing those out or sharing them with your providers.
Okay, we'll make a plan with you and we'll follow up with everyone on this call. Thank you.
Okay, yeah, great. And then my last point that I want to share is, which Jody kind of touched on already, is the weekly calls that we've been holding for people to be able to call in with any questions that they have, and that we could, or any best practices that they've implemented that they would like to share with us and others on the call that we can kind of spread around, because we've been getting great feedback from folks on things that they're doing, one of which being, setting up a temporary hand wash station at the front door so that people are washing their hands as they enter the facility. And there is a diagram in the sanitation and hygiene guide that shows how to prepare a temporary hand wash station if you would like to increase access to hand washing at your sites. So things like that are discussed on the calls, and those are every Tuesday and Thursday from 11 a.m. to 11:30. We shortened them to 30 minutes just because we didn't get a ton of people on the calls last week, but if we need to extend those call times, we can definitely do that. And with that, I will pass it back over to you, Allison.
Marta, thank you very much. And thank you, Jody, as well. I see a couple of questions that are detailed about what proportion of bleach to water. What I'm going to say is Jody and Marta are your wonderful, wonderful resources, and those Tuesday and Thursday calls are a great tool. I am not going to take time right now to go into that, but I want to talk a little bit about the fact that while we have this excellent information and guidance and really people in our Healthcare for the Homeless network and at our public health department who didn't just start thinking about this sort of issue a few weeks ago, who are among the most knowledgeable and experienced public health professionals in the country. Full disclosure, I worked at the public health department once upon a time before I came to the coalition. But while we have those folks and they're doing their very, very best work and working really long hours, as many of you on this call are, guidance does change. So I want to just reiterate the fact that while you should go to those websites, we will follow up with an email to everyone on this call if you put your email in the chat box, because we didn't make you register. So put your email in the chat box if you want follow-up information from us. We've got information on our blog, Healthcare for the Homeless Network. Website is going to be constantly updated, but these documents may also change. We're just at the point where we have to recognize this is a new disease. My sister-in-law is an infectious disease doctor who has actually worked on a treatment for the Ebola virus, and she is working nonstop to work on the coronavirus. And when I ask her a whole lot of questions that are probably the same questions that are on your minds, most of what her answers to me consist of, we don't know, it's new. We don't know, it's new. So just bear in mind, you are all, those of you who work in homeless services and human services, you know how to be adaptable. We salute you in your adaptability, and it's going to come in great use to you at this time. And that is also sometimes stressful because you think you've got a system in place and then you might need to adjust it. But I think if you know that going into it, you've got some great partners who are very knowledgeable, who really will problem solve with you. I want to say I talked with Diana Salazar at the City of Seattle Human Services Department and with a couple of other people in the last 24 hours. And while they're not on this call, I can tell you a little bit about what is happening, which is that there are going to be, I believe, 88 sets of porta potties and hand washing stations starting to be set up in Seattle. Obviously, we know we need additional resources like that in other parts of King County as well. And there are going to be at least 4 additional shelter sites that are going to be stood up fairly quickly. However, as I think you gleaned from the comments that Jody gave earlier, there are a few things going on at once. And those things, broadly speaking, are, number one, needing to support the existing shelter and day center services so that they are complying with the 6-foot distance and other guidance. Number two, and prioritizing those that are serving highly vulnerable people. We know all people experiencing homelessness are at great risk, and many experience disabilities, many are over 60, many have underlying health conditions that have not been adequately addressed. So we have a highly vulnerable group of people, and we need to figure out how to decongest existing services, and that is underway. Also, we had 6,000 people without shelter a month ago. That was a disaster and an emergency a month ago. Now it is even more urgent to create additional safe indoor and outdoor places for people to be and to get their needs met. And then the third thing that's happening, which Leo will be joining us, I believe, at 9:50 to talk about, is the creation of what are some new isolation, quarantine, and recovery care centers. There are a number of them. There are a few that are already operating, and they are creating sites across King County right now. So Leo is going to be able to speak to those. And let's see, let me just check my notes because I think there might be a couple of other things I want to say. Oh, just about service changes. So those of you who are on this call, who are providing direct services, I am sure that you have made adjustments. Sadly, one of the things that we're seeing is that in addition to having lost spaces at our public libraries and community centers for reasons that I think we all understand, we are now seeing that programs, for a variety of reasons, including some real concerns about staffing capacity, are modifying and in some cases limiting their service availability. And some of that we hope will be addressed by having some additional capacity. And some of that we hope will be addressed by getting some really serious additional resources. I think some of you know, because I've spoken with you about this, the coalition has been advocating hard for the governor to mobilize the National Guard as a resource for our entire state, but in particular because we know that we need additional people and infrastructure capacity to serve people experiencing homelessness. So we are working on that, but we also know that we've got a lot of folks who are working in direct services who, like everybody else, are caring for kids who are home from school, elders, people in their family who may have suppressed immune systems. And as soon as testing is more widely available in our community, I just want to recognize what I think we all are aware of. Many more people, including some of our friends and colleagues, some of the people on this call, are going to find that they test positive for COVID. Right now, we don't have very good, clear information about what it means to our system, but we can anticipate that what it means is we are going to experience some really serious staffing concerns. So I have elevated those through the Commerce Department to the governor's office. I have spoken with members of Congress about these issues. I'm speaking with local philanthropy about those issues. And we are in alignment with, I think, our next guest here, Leo Flor, about the fact that we urgently need to make extremely good use of the skilled homeless service staff and start training and bringing on board additional people who are going to be able to provide additional support. Leo, can you let me know if you are on the call? I think you are unmuted.
I'm here.
Wonderful. Welcome, Leo. Hi there. Okay, it's a great pleasure to introduce you. We've got about 100 people on the call, some of them on video. I just want to tell everyone who may not have had the pleasure of meeting you in person, Leo Flor is the director of King County's Community and Human Services Department. And Leo connected with the coalition many years ago when we were doing the one night count as, I believe, a volunteer for what was then the Veterans Interview Project. So we've got some long connections, deep respect, and great appreciation for the extraordinary work, Leo, that you and your team are doing. And thanks for joining us for about 15 minutes this morning.
Yeah, absolutely. I think the real appreciation, we've got a network of folks, many of whom are on this call right now, that are out doing frontline work. And just as often as we've been hearing, I think rightfully, about what first responders are doing, the people on this call are first responders before the first responders get there, often for the people that we serve. So I share my deep appreciation for the work that you all are doing. And I think we're, right now, the work that you're all doing is saving lives. And it always does. So just a quick real-time check with you here, Allison. What I can focus on is isolation quarantine, if Jody has already been on to talk about some of the things we're doing in shelters.
Yes, you got it. We had Jody first and Marta Lema, and I told people that was part of what you would speak to, is isolation and quarantine. Thank you.
Great. So isolation and quarantine, just if you're like me and you get confused easily, isolation means that somebody is positive. Isolation is, so you've got the diagnosis, and then quarantine means that you've got a exposure or are likely to have been or to have the diagnosis, but we don't know that for sure. So that's just the two terms. What we know is that the vast majority of people in King County, and I think that the numbers now are probably in the thousands, who isolate and quarantine, just do it in their own home. And nobody is monitoring all their movement. Nobody is asking, whether they have appropriate care on site. They're doing it in every neighborhood, in every part of the county. So we know that the vast majority of people have the choice to go to a home of their own to isolate and quarantine, because isolation and quarantine are, proven public health practices to slow the spread and keep from overwhelming the hospitals. We also know, and you all especially know, that there is a group of people in our community who does not have the luxury of isolating or quarantining in a home of their own. And so that is the problem that we're trying to solve with a network of facilities across the county, designed to provide people who cannot safely isolate or quarantine in a home of their own a place to do that, because it's better for them and it's better for the public health responses. We're trying to slow the spread. And it is also something that's uniquely important for folks experiencing homelessness, specifically because the other place that those folks can be is either in a hospital, taking a bed, or back in a shelter, exposing the larger community there potentially to the virus. And we all know that the conditions in a shelter are tailor-made for something like a virus to spread really rapidly. And so that's in a really stark way, the problem that we're trying to solve with these isolation and quarantine facilities. We have a network of them that we are building across the county right now. So the first two that ended up being announced, there's a motel in Kent that will eventually have room for up to 79 folks. We're working furiously to get all of those rooms online right now. And it's actually, it's got guests in it right now. We've got a facility in White Center that is not gonna be online until early April. We have another facility in North Seattle at Aurora and 128th that's gonna have 21 or 23 rooms. That's gonna be online this weekend to begin to receive folks. We have a hotel in Issaquah that we have acquired for 100 rooms, and that's gonna be, we don't know when that'll be online, and we're trying to work right now with other folks who might be able to operate it. As Allison was just mentioning, staff is the critical shortage in this whole thing, and we anticipate that that's going to continue to be the case, and that need will actually become more acute as we have folks experiencing illness themselves. And that's the sort of set of established isolation quarantine facilities right now. There's another set of facilities that you'll have heard about in the news. What we're calling congregate facilities are assessment centers and recovery centers. And these are facilities that are for 100 to 400 people at a time that we think are really going to be key in the height of the emergency response. I'll talk about those a little bit at the end, but we so far have located those in a couple of places in the county, some of which we're still working through and some of which are out there. But the two that folks know of are one in Eastgate at Bellevue, and then one in Interbay, up between Magnolia and Queen Anne. And then some folks will see that there was an announcement by the city of Shoreline. They used a term that I don't think is accurate. They called it a field hospital. It is on a field, but it is not going to be a hospital. So that's going to be an assessment center and a recovery center. But the idea there is it's a place for folks to be able to go if they have no place else to go, to get assessed, to determine what their level of medical need is, and then tested. And then as we await their test results, they can stay there in quarantine. And then if they end up testing positive, move through into isolation on the other side of the facility. But again, the idea there is to create a non-hospital capacity for people who are not emergent. That way we don't swamp the hospital emergency departments, and we can take care of folks closer to their communities as well. So inside of the isolation and quarantine facilities, as they're coming online right now, one of the big things that we are seeing is it's really important. These are all voluntary. We in our community are not compelling people to stay in isolation and quarantine right now. That's a policy decision that is not the direction that our local leadership is going. And it keeps it consistent in publicly provided isolation facilities the same way that we're doing it in the broader public. Nobody is walking around all the neighborhoods and making sure that Leo Flor is isolating himself properly, in his neighborhood in West Seattle. And so it's the same standard being applied to folks who are at isolation and quarantine facilities that are publicly provided. At the same time, we've got to make these a place where somebody can be successful. So the way that we're doing that is we're making sure that it's a comfortable place, that we've got food available, that we're able to provide entertainment. So, folks have access to a TV or a phone, because you don't want to be in a hotel room with no TV or phone for 14 days potentially. We're making sure that there are social services on site. Behavioral health is the big focus right now. I think if somebody had a behavioral health condition and then you take them to a neighborhood that they're not from and put them in a hotel for 14 days, that's an understandably traumatic experience. And so we're really trying to make sure that we've got access to on-site behavioral health, and then also reach back access to people's case managers that they had before, if they've had them, so that they can maintain those care relationships with behavioral health or medical providers. So that's the concept for all of these facilities. What we'll say right now is the challenge so far has been staffing. How do we find the right number and skilled staff to get to all of these facilities so that we can provide the care on site in a really responsive way, so that people have the opportunity to be successful in the facility and don't feel a need to leave the facility because they're not having their basic needs met there and some of their service needs met there as well. So eventually, by the middle of April, we'll have these 4 facilities up and operating. There are additional facilities that we're developing right now in other parts of the county. There are locations that I won't discuss here today, but we're absolutely aware that if you take a look at our total homelessness, our population experiencing homelessness, and you just start to apply percentages of who's likely to become ill and what percentage of that illness is likely to be serious, the number goes up over 1,000 very quickly. If we're successful in a lot of the things that Jody shared about earlier, we'll be able to, quote unquote, flatten the curve, as everyone likes to say now, but to distribute that, more than 1,000 people over a period of time, that they don't all come at once and need help all at once. And so that's critical to our ability to make the amount of new capacity that we're standing up in the system meet the need that we think that we're going to experience over what is certainly going to be weeks or months of our experience of this virus spreading in our community. So I guess the last thing that I'll share here is very early on, there was a tone of question that certainly I would get about, are folks experiencing homelessness uniquely sort of threats to the community. I know everyone on this call just rejects that premise outright. And we all share the value that folks experiencing homelessness are uniquely vulnerable because of the way that they live in shelters or out in the community that really create the conditions that increase the likelihood of spread, because they are older on average than the general population, and because being homeless is hard and it makes underlying health conditions more prevalent. And that is also one of the risk factors that we know really exposes folks to vulnerability for homelessness, and so, or for COVID-19. So we think we have a unique obligation here to make sure that we've identified the most vulnerable people in our community and make sure that we're intervening and giving them an opportunity to stay healthy here. And it's just super clear that for us at large scale, some of the most vulnerable people in our community to this disease are folks experiencing homelessness. And that's why the sort of scale and speed of a response to stand up what will be a total system capacity for up to 3,000 beds if everything that we've got in the works comes to pass over the next 4 to 6 weeks. I mentioned that I would talk a little bit about the congregate settings that we're standing up. Where I think these isolation and quarantine facilities, we're planning to operate these for months. And by months, I mean, somewhere on order of a year plus, because we think that this, and that coincides with the amount of time that we think it's going to take medical interventions to really show up in large numbers that can prevent or treat or cure the disease. So we do anticipate that we're going to have these publicly operated isolation and quarantine facilities for that long. On the shorter term, we think that we need a much larger emergency capacity, and this is these large congregate settings. And I've mentioned that we have already identified Eastgate. I saw one of the chat questions, just to repeat it. Shoreline is a site that the city of Shoreline has identified and has volunteered. It's not a site that we've set out to operationalize yet, but it's a site that we have in the inventory. And we are certainly looking for more sites right now, but we think this is going to be a region-wide need. Ideally, these sites are close to hospitals, but not necessarily right at hospitals, and that's so that they can perform this function to alleviate pressure on hospital emergency departments and be a place that folks can go to if they're not emergent themselves, but can still receive care and don't have the ability to stay in their own home. We think that this is going to be a big part of the inventory over the short term, as either a lot of people need to go there individually, or we are also, just preparing for the contingency that we might have shelters themselves become inoperable, either because the number of people within them who become ill or the staff operating them become ill. So that's absolutely a contingency that we're preparing for. And that's one of the reasons to stand up these large congregate facilities, so that we have some capacity in our system to handle a situation like that. So what Jody said that we were doing, reinforce the existing shelter system. At the same time, building an isolation and quarantine system that's publicly provided for folks who cannot safely isolate and quarantine in their own home, because isolation and quarantine are public health interventions that slow the spread. And then also standing up an emergent congregate capacity and doing all three of those at the same time, because I think we're going to need all three of those at the same time. So that's what I've got, but happy to answer questions.
Yeah, and Leo, I think just to your last sum up point, I'd say there's a fourth element, which is sustaining to the greatest extent possible our existing network of care for people experiencing homelessness or people who were homeless and are now in homes. And we know that they are also experiencing additional strain, and they also have staff who are definitely going to wind up becoming ill themselves. So I want to just name for people that in addition to what Leo just described, all of which is new and additional, I think there's a real commitment from King County to ensure that there's support for existing programs, including the possibility of outreach and some of the, what we are calling shelter in place, not like what San Francisco and other cities are determining, but recognizing that with such a large number, thousands of people who aren't in shelter now, and for whom some of those congregate settings might not work, we are going to need to have some very thoughtful, very good interventions in place. So I want to acknowledge that the work that the Healthcare for the Homeless Network and some of our member providers are doing is in part around thinking about how to provide care to people who are already left out of our existing system.
And just to echo that, you know, what we, I think, have concluded over the last 2 weeks is that the number one most effective intervention in the whole thing is to keep people healthy.
Yes.
And for folks experiencing homelessness, the way to keep people healthy is to go to where they are, and that is either in shelters right now or out in the community, and do everything we can, you know, just sort of fight like hell to make those spaces as safe as we can. And so that's the de-intensification that both King County and the city of Seattle have been engaging in. That's the information, you know, the guidance out to shelters. That's the FAST team that Jody might have mentioned this morning. That's the cleaning contracts. That's all of that. That's the only intervention that doesn't wait for somebody to become ill before providing the service. Whereas all the rest of it is, what do we do when large numbers of people begin to become ill, and then how do we isolate and quarantine and treat them? But it's really clear that we've got to, you know, keep people healthy as much as we can.
Right. And Leo, I also want to say I've really appreciated that folks on your team, excuse me, I'm just going to ask Jason to read a text I got and talk with Hillary about how we make sure that Representative Macri is able to get onto our full call. Hillary's on it. Thank you. Leo, I've appreciated that, you know, your folks have done a really good job of describing the fact that it is not only people experiencing homelessness who are not able to shelter at home, isolate, excuse me, or self-quarantine at home, but also people who may be traveling, who have somebody with a compromised immune system or who's at risk in their own home. And we've certainly advocated, and I think your team understands this well, that, for example, when speaking with reporters, there's really no reason to identify someone's housing status when they are admitted to an isolation and quarantine facility any more than we would reference their race, ethnicity, belief system, or immigration status. I think in terms of quelling people's fears and misunderstandings about vulnerability versus spreading a disease, we've really appreciated that. Can you speak a little bit, Leo, to the issue of staffing? And we've certainly advocated, and again, I think your folks have been really helpful, and we're in alignment around the fact that direct service providers need to be prioritized for testing. We understand that testing doesn't equal treatment, but testing is one of the key ways that researchers can understand the spread of the disease, as well as we can figure out who does need perhaps isolation and quarantine. And this might be a good point to remind everyone that 80 to 85% of people who get COVID-19 will not have serious symptoms, which is another reason we have to keep practicing good sanitation and distancing, and another reason that quarantine matters, but that we can't freak out about people testing positive. Nevertheless, it is a very serious disease, and it does seem to be affecting people who are younger, at least in the latest round. So it's not only people over 60. Anyway, I've derailed the question, but the question is, Leo, could you just speak a little bit more about staffing and what you are anticipating and what you are doing?
Yeah, so in every conversation at the county, at the city, at the state level that I've been involved in, every slide or briefing paper has one statement in red letters underlined, which is that the critical constraint in our system is staffing. It is actually not sites, and I don't think it's going to be equipment at these facilities, although personal protective equipment is also an important constraint, but it is people. And it's because our system in the first place already depended on a dedicated and small number of people to provide services in shelters and out in the community. And that the way that this virus operates is that it takes people offline as they get ill and then need to recover. And so we've been advocating very strongly that in order to actually operationalize any of the things that I've just described, which again are reinforcing the existing shelter network and keeping it working, and then isolation and quarantine, and then congregate settings, none of that actually works unless we get access to more people who can provide those services. And I think some of those folks that's taking, as Allison was saying, that's taking care of the folks that are already in the system doing the work and setting the conditions for them to be successful. And then it is also for you to be successful. It is also asking for additional people. And so we have been asking clearly and continue to ask that if we need, for example, to keep the existing shelter system operating just at its current level, that we are going to need dozens and dozens of people to come in and supplement staffs at shelters, or be prepared to supplement staffs at shelters and outreach teams. So that's absolutely been part of our request. And that some of those folks need to have specific medical or behavioral health skills, and that some of those folks just need to be entrepreneurial and have a good attitude, and that you know can work too, and good values. And then the other request that we've made really clearly is that for any of the congregate settings to work, we are going to need people in the hundreds to be able to come in and operationalize those sites, so that we not only have them, but they actually contribute to a person's health and provide safe locations for care, and that they are places that people will want to be and to stay. And staffing is a really important part of that. I will say that within the isolation and quarantine network, we are taking that on internally at the county right now. And so, you know, we have folks that are normally contract monitors or any number of other sort of county functions, and they are instead, you know, learning how to code keys at a motel in Kent so that they can manage the facility. We are having volunteers that do behavioral health services in other contexts on site at these facilities. So we're working with Metro, who's, you know, we've got some bus drivers who are staying overnight to help make sure that we're staffed up at facilities. And it turns out that they're actually really wonderful at this work because they work with the population quite a bit.
Right.
And so it's staff. That is the critical constraint. It's people, and that's what it's going to take to make this system work. I don't have any specific information for folks on this call this morning about you know, how that is coming into the community or when that will come into the community. But the executive has been very clear in conversations at the state level that that is a resource that we think is vitally important to our ability to succeed.
Thank you so much, Leo. As I think you're aware, and I'm certainly seeing, there are some excellent comments and suggestions in the chat box, and we will compile them and send them to you. I think everyone is aware that as many people are losing jobs, some of those people may indeed be well suited, both in terms of values and their people skills, and their ability to maintain a sense of humor under difficult circumstances, to help provide additional support. And then our current staff might be really important in helping to train and socialize folks to a harm reduction approach to this work. There's so much more to say, but I know that we have Representative Macri on, I'm trying not to say on the call, at our meeting, attending our membership meeting. Leo, thank you so much for being clear and transparent, for being available to us when we have questions, for making yourself available this morning. If you're able to stay on, that's wonderful, but I have a feeling you may have many other things that you need to do. So I really want to thank you very much, and we're giving you and Jody and Marta a virtual round of applause.
Thank you, and I'll just say it again, it's really the people on this call are the people making it happen. We understand at the county that our job is to set the conditions for you all to be successful. So we're gonna keep doing that, and you know, thanks for fighting out there. Thanks for doing it. We, I think, are collectively doing things that are actually saving lives right now. And not everybody gets to say that. So it's really cool to be just loosely associated with a group of people this cool. And then just also so that you know, because I don't think she'll say it herself, Representative Macri coming on after me has just been tireless and clear in her advocacy around this. I think you all know that, but she certainly both asks me tough questions to make sure that we're doing the right thing, and has been asking a lot of people the right and tough questions. And so she's another person that I think has been doing wonderful work. So that's, I am gonna run and see if we can get some more of these facilities off the ground, but thanks very much for what everybody's doing.
Thank you very much, Leo. Just to close out this portion of our agenda, I want to let folks know that the coalition is partnering with people in Leo's department to do some work to get a handle on what system issues and system changes are happening. So you will be hearing from probably the coalition in partnership with Charles Schrag, and you will be getting either a phone call or a very short survey or both. And we want to ask everyone on this call in this meeting who is a direct service provider to please make sure that if you are making service adjustments, you are sending an email to COVID homelessness response at kingcounty.gov describing what you're doing. For example, your day center hours are limited to 4 hours in the morning only. You are making your meal program a to-go program. Those are the kinds of things that we're hearing are happening. And we know that it's a constant process of adjusting. So please make sure that you are sending details about that information to us. And we are going to also use that as a feedback loop to give people like Leo and folks at the state a better understanding of what the current capacity and loss of service is and what increases in service could look like. All right, Representative Macri, I see you there. I think you are muted, so could you try pressing *6? There we go.
Thank you.
Okay, so Representative Macri, Nicole, I think we had this plan that we were going to figure out a fancy way to share the screen, and maybe Sasha and Hillary are working on that. Oh, good. So for those who have video, you can see this beautiful picture that was taken by a staff person at DESC during Housing and Homelessness Advocacy Day of Representative Macri's constituents from the 43rd LD, smiling and standing very close to each other because those were different times, with a sign that says Representative Macri, Housing Champion, and that's Queen Bee from the YWCA and Women in Black holding the sign up. So we want to thank you for being a housing champion and for having done truly extraordinary, amazing, historic work during our supplemental budget session, this past session that just ended last Thursday, but also for being just a clarion voice that this crisis is going to hit people experiencing homelessness especially hard, that we are dealing with an emergency on top of an emergency. And we're so grateful to you for joining the meeting virtually.
Yeah, well, thanks for having me. Hopefully you can hear me okay. And thanks for accommodating my schedule to join a little late. As a citizen legislator, I've been back at work at DESC since before session ended, particularly since the COVID-19 stuff has ramped up. And I'm sure DESC is like many of your organizations in that we are having constant meetings and gatherings virtually to plan in this ever-changing environment. So I had one of those this morning. And it's great to be here. Yeah, and I loved your agenda. Yeah, remember we had that legislative session. It feels so long ago, but it actually ended less than a week ago on last Thursday night. And it was, in terms of housing and homelessness issues, again, one of the best sessions that we have had. This is building, I think, also on the last 2 sessions where we've had great successes. So I can rattle through a number of policy and budget wins. I can also talk a little bit about what's happening at the state level in terms of COVID-19 response. The headline, I think, really is, as I've said in other times when I've joined your meeting, is that advocacy makes all the difference. The work that you all do in capturing what is happening in King County, what the work that other people do around the state, so we can understand how these challenges around housing stability and homelessness are impacting people, make all the difference. The thing that I get to do is I know some people and their phone numbers that some of you all don't know, and so I'm able just to take the stories that you share with me and make sure they're getting to the right people in the right moment. So it truly is a team effort. There are a few things I want to highlight of really big wins that I think we had this session. More than anything else, I think our supplemental operating and capital budgets were enormous wins. Unprecedented investments in addressing homelessness, not only in emergency responses to homelessness and investments in things like, really for the first time in history, significant investments in emergency shelter, but at the same time, lawmakers understood the importance of also continuing to invest in housing opportunities for people who are currently homeless. That's the only way we can really address these challenges effectively, is not only to respond to people's emergent needs, but also to make sure that we're creating the housing opportunities that ultimately will end the crisis of homelessness. So I'm sure the coalition has sent out some of that information, but we are talking over a 4-year period, over $230 million in new investments. It certainly does not meet the full need, but is unprecedented and will take us further down the road than ever before. And in light of the crisis around coronavirus, I can't think of where we would be without having made investments of this level. I'll also say that, we did this $200 million disaster recovery investment out of the rainy day fund, a bill we passed on the very last day of session and the very final hours of session. That bill started, it was introduced as a $50 million transfer and ultimately ended at $200 million. Still not enough resource, we know that. That's clear to us even just a few days after session ended. But it would not have been that great if not for the advocacy of people working on behalf of folks experiencing homelessness and doing some quick work to help educate lawmakers about the intersection of the crisis of homelessness with the crisis of this coronavirus outbreak. So that is big. And because of your advocacy and my ability to amplify that, the Department of Commerce was able to get out word on Monday morning, first thing, about driving dollars out to counties across the state specifically to address coronavirus. So all of that is good. The long-term investments, plans are coming together for that now and how those dollars will get out the door, but most immediately getting those coronavirus response dollars out specifically to ensure that our vulnerable homeless populations are getting support. We're expanding opportunities to bring people inside and make sure they can socially distance, recover, and isolate during this time of crisis. A couple of unprecedented things in the budget that I wanted to mention in particular: a $15 million increase in the Housing and Essential Needs Program, hugely important, and something that this coalition in particular has been at the forefront of advocating for a very long time. New investments in operations, maintenance, and support services for people living in permanent supportive housing. which is huge and unprecedented in terms of state level investment. Our local governments have been really good partners in expanding permanent supportive housing dollars, but the state has been slower to come to this, so that's been really great. And really, this coalition and the work that you did with City of Seattle and the council members there to do a pilot around what some call the SSI cliff for people who are disabled, many of whom were on housing and essential needs and lost their eligibility for that program when they receive federal disability benefits. We were able to get in the budget a $5 million pilot to address the housing needs of people living with disabilities on fixed incomes like SSI and SSDI. And those dollars will be dedicated to the 5 counties that are the highest cost counties in the state. That includes King County, obviously, we're number 1. Lucky us. Maybe not on that on that measure, but we definitely are number 1. So that's budget, which is very great. I'm getting a lot of questions now as to how much of the sort of operating budget will be diverted to coronavirus response, and what does that mean for long-term responses to homelessness? You know, the world is upside down right now, so I don't have a clear answer to that. I will just say that I think our state leaders, including Lisa Brown, who's the director of the Department of Commerce, is really trying to be thoughtful about how we balance emergency need and long-term need. I do also want to comment again back on these budget issues as well as on the corona virus response, that the work that you all did, like literally last minute, the final afternoon of session, to help organize with the leadership of the Washington Low Income Housing Alliance a statewide sign-on letter to ask the governor and his key policy leads to take dramatic action in response to coronavirus and its impacts on people living in low-income housing and who are living homeless, had a dramatic effect. You saw yesterday the governor came out with an announcement of multiple proclamations. I'm sure you're already talking about this, but that included a moratorium on evictions. Their work continues in terms of how they are thinking about the ongoing response. You heard a little bit of that. I was able to hear a little bit of what Leo was talking about. Some of the support and response they're getting from the state is directly related to the statewide advocacy that was mobilized so quickly. We got 200 organizational signers on a letter with about 3 hours notice, and that made a huge, huge difference. People in the highest levels of leadership, including our governor, took that very, very seriously. So advocacy works. I can't emphasize that enough. You want me to talk about policy bills? Did Michelle already cover all that?
No, we actually put you on first, and we have Xochitl and Marcy Bowers actually coming next to talk about statewide eviction, 30-day eviction moratorium, and then Marcy is going to talk about some really important changes to TANF regulations on an emergency basis. And then Michele, thank you for hanging in there with us, everybody, on this shift up of our schedule, and also Sarah from Child Care Resources. So I hate to say this, but I think probably we should let other people talk, and then we're gonna, you know, some point, possibly in writing or possibly in another video meeting, dive more deeply into policy issues. Is there a particular policy bill, you worked on so many, that you might like to just touch on for a couple of minutes before we maybe let Xochitl speak next?
Yeah, no, I think I'll just say those 3 speakers who are going to follow me are amazing. And you all are very, very well represented in Olympia by them. I'm hoping Xochitl will not only talk about the governor's proclamation, but also the Supreme Court's paper that they put out yesterday evening as well that will have a very positive impact, not only on evictions, but other harms that we know disproportionately happen to people experiencing homelessness as they are put through the court system. So I worked on a couple of bills this session that were not successful. I want to just mention them because you all did tremendous advocacy on them. And just because we didn't get them through this session doesn't mean that we won't eventually. And I actually feel like this horrific crisis that we're going through right now helps to underscore the importance of both of them. So the first one was working on just cause eviction protections for renters across our state. We got that bill very far in the House, and we did a ton of education with members of the House of Representatives around that bill. There's still a strong bias against renters in our state, even though renters make up nearly 40% of all residents of our state. I have a feeling this crisis that we're going through right now is going to help policymakers understand the impacts of not having stability. And interestingly, and so she or Michele can talk a bit more about this, the way the governor's proclamation came out yesterday, I think it is a tacit acknowledgement of the huge challenges we have in our state, where the majority of residents are not covered by just cause. We have 3 jurisdictions in the state that have just cause protections. They're all located within King County: Seattle, Burien, and Federal Way. Everybody else is really quite exposed to a huge amount of risk. And then the other big one that I worked on was a progressive business tax to address homelessness and housing instability and behavioral health. And again, we got very, very far on that. Huge education with members of the House and the Senate both. We did not get it over the finish line. That is not uncommon in Olympia when you have a really big, bold policy idea. But as you can see, the conversation continues within Seattle right now about the need for a progressive business tax to address our most emergent needs. A lot of the work that we did in Olympia, I think, has informed the conversation that's happening now in Seattle. It's something that we all are going to need to continue to push on. I feel strongly that a regional approach is going to be the best approach. But that doesn't mean that it has to be an either or. The conversation can continue in Seattle, and we may even see action in Seattle, and we can still build upon that as we go into the next session. So I'm going to be continuing to talk to our local elected officials here in Seattle, continuing to talk to people across King County, and then back at the State House whenever we get called back for session, which I have a feeling might be before next January.
Yeah.
So I'll leave it at that and say we did a tremendous work on the policy stuff. You'll hear that from the speakers who will follow me. Those bills will make an immediate and big difference in the lives of people who are at risk of homelessness or experiencing homelessness. And we all should be very, very proud of the work that we accomplished this session. So while many of us, all of us are focused right now at the crisis at hand, we have built a foundation through the policy and budget work that we did this session that puts us on better footing in the short term and in the long term. And I'm really grateful to all of you.
Thank you so much. Thank you, Nicole. We really, really appreciate you, and we will continue to mobilize coalition members to back you and other leaders in Olympia and to put pressure right now. I think you're right. There's going to be a special session before long. Thank you so much. We welcome you to stay on if you're able to, understand if you can't. And now Xochitl Mayko from Washington can, who has been a tireless and smart advocate at the local and state level, is going to give us a little bit of a download on some head-spinningly fast announcements, although maybe not fast enough, related to some of these policy issues. Thanks, Xochitl.
Yes, okay, so I'm gonna, in the chat, I'm gonna share a spreadsheet. it's view only, but basically it has everything that I'm aware of related to housing that's been done on the federal, local, or state level. There's one more that I got to add, but I'll do that after I'm done talking to you. So I'll just start from the top to the bottom, just as this is helpful. This I don't think will impact many people on this call and people that the folks that we work with, but the eviction and foreclosure moratorium that the federal government did yesterday, it's for 60 days, but it's specifically for single family homes with FHA mortgage insurance. So it's narrow, but because I know a lot of people were on Twitter. Oh, oops! I think I only sent it to one person privately. Everyone.
We'll make sure we send it out to everyone, Xochitl, so you can just concentrate on talking, and we'll get it to you.
Sorry. And so I just know a lot of people were posting about that yesterday on social media, so I just wanted to clear that up. But then there's been a couple other good things. So yesterday, Governor Inslee did an eviction moratorium on 14-day notices as well as 20-day notices. Landlord can only use a 20-day no cause notice if they can essentially prove that it's necessary for the health and safety of the tenant, which I think is essentially making it a for cause notice. As you know, basically, I think what Representative Macri said is, I hope the legislature is realizing now why we need just cause. And it also says that law enforcement can't carry out any physical evictions for evictions related to non-payment of rent, which I think is great. Then also the Supreme Court, which I think the courts have been getting beaten up quite a bit. We generated like 318 emails to them. I'm just very happy and proud of that because they were being really dumb. Because Kentucky and Idaho and many other court systems throughout the country have basically postponed all non-emergencies to later. And the Supreme Court was dragging their feet, but finally last night they have postponed, related to evictions at least, they've postponed non-emergency civil matters for after April 24th. So anything that's already in process, it's going to be postponed until later. Now, one sort of big hole in the governor's moratorium is that it didn't ban late fees, but that's something that I think we can continue to push for. But there's several local jurisdictions that have done so. So, and some have also sort of made the eviction moratorium broader. So the city of Seattle has banned like all eviction actions unless it's like related to health or safety. It also banned late fees. That is in effect from the 16th through, it's through the 15th, for 60 days. So from March 16th through May 15th. Then Kenmore did a similar order. I didn't realize Kenmore was, I think it's a place that we can probably start pushing just cause after this because they seem very pro-tenant, but anyway. Burien also did something similar where, except it's specifically on non-payment cases, but they also banned late fees and it's for 30 days. Woodinville banned evictions for non-payment and banned late fees from the 17th to May 1st. The Auburn passed this after Governor Inslee's eviction moratorium, but they essentially said, hey, we support Governor Inslee's eviction moratorium, but we also want to ban late fees. And then the city of Everett also banned non-payment evictions and banned late fees. So I think the thing for us to do specifically on this is continue banning late fees, because if we, if the 20% of people have been laid off, I've just been seeing huge numbers. There's gonna be a lot of people who aren't gonna be able to pay rent on time. So we're really gonna have to ban late fees. Otherwise it's gonna increase the cost of paying all of this off after. And then in addition to that, we're pushing for increased rental assistance on like the local, state, federal level. I know that from what I've been told from folks is that the county and the city of Seattle are looking at rental assistance. I think specifically programs like Home Base that's run by United Way would be a good program to really try to funnel all of the money to, because it's centralized and they work directly with lawyers, and it would reduce overhead costs. So I think that's kind of like the next two things that we got to work on.
Yes, thanks, Xochitl. We are definitely recommending that that's a place where a major infusion of resources needs to go, because there is actually an infrastructure set up to help people that way. And I want to thank you so much for sharing your document, and we will send it out to people. This is just a reminder, we've maxed out. So we have 99 people on this call. We're obviously going to need to look into expanding for future meetings to allow everybody to join who wants to. But we will send resources out. However, we didn't require people to register. So if you are attending this virtual meeting and you have not put your email address in the chat box, please do so right now so that we can send you a short survey, which I think Hillary is going to put up in the chat box as well as these resources afterwards. Obviously, there's a lot of detail and things are changing. I want to just ask you one thing, Xochitl. There's stuff happening on the local level, and then there was this state level announcement from the governor. Can you speak briefly to how those things interact, because they're not all the same? So does the governor's announcement overlay onto local? How do those two levels of moratoria play with each other?
I would look at the governor's action like the minimum. So things on the local level that go farther. It's kind of, think about like the minimum wage, right? Like the state is the minimum. And also someone had one other question about the governor's moratorium. It does prevent landlords from taking legal action. It didn't explicitly say filing, but I think filing would be considered legal action for things related to non-payment during the moratorium.
Great. I'm going to assume that you're writing something up quickly, or you may already have something written, and we'll share that with people, because there's definitely more than we're going to be able to share now. But I want to thank you so much. And just recognize that the folks who did incredible work during session, including Representative Macri, Xochitl, Marcy Bowers from Poverty Action is going to speak next, basically did not take a breath. Session ended and everyone pivoted to what are we doing around these same important policy issues to protect vulnerable populations, to protect our neighbors, our friends, our relatives, ourselves. In this extraordinary time. Thank you so much, Xochitl. We know we will be continuing to be in close contact with you. And Marcy Bowers also could talk at length about amazing policy changes, but because there's some dramatic things that are happening around TANF and maybe also EBT, I'm not sure yet. I'm going to ask Marcy to speak next. She's holding up her crossed fingers. I just want to say, for those of you who are only attending the meeting by phone, part of what you're missing is the joy of seeing people's faces and their kids sometimes, and someone who has, I believe, a pet raven, which I am going to need to hear more about. And so we look forward to getting to know some very delightful idiosyncrasies of our coalition members and friends. Marcy, over to you. Oh, you might need to press *6.
Yeah, I did. I think.
There we go. Thank you.
Yep. Okay. I got notice that I needed you to unmute me first.
Got it.
Good morning, everyone. I am going to try and give you some very complicated information very quickly and as uncomplicated as I possibly can. I'm going to leave off any legislative updates. Partly, I think Xochitl covered some, Nicole covered some, I think Michele will cover some, and the ones to TANF that I'm thinking of are not actually implemented for a while, so I'd rather just leave that off to avoid confusion and focus on what is happening right now.
Good.
So I joined a call with the Community Services Division of DSHS. That is the section of DSHS that handles temporary assistance for needy families, ABD, a few other programs, but those are sort of the ones that I typically report to this group about. And I wanted to let you know that they are waiving a ton of the requirements that TANF parents and ABD recipients are required to do in order to continue receiving their benefit. So there are a number of things that they are doing, but probably the best way to describe it is they are considering virtually everything related to COVID-19 as a just cause reason for not being able to meet work requirements, the demands of an individual responsibility plan. They are not sanctioning any families. So for people who are not able to meet with their caseworkers because they either have kids at home who are not in school, because they cannot do a job search because there are no jobs to search for right now because people are getting laid off. If people have been laid off, all of those sort of work requirements, work participation things have been waived, and families will not be sanctioned for not being able to participate in the demands of work first. So that's a huge victory for a whole lot of families who are going to be really stressed out about trying to meet demands that are just unreasonable to meet at this point. Similarly, DSHS is, people will still be required to do the mandatory orientation. However, that can happen over the phone now. So that has been something that has barred a lot of people from being able to access the program in the first place, is needing to come in person to an office to get an orientation. That orientation can now happen on the phone. They are also exploring ways to actually get signed up for the first time over the phone, which is typically not allowed. Typically, you have to meet in person with a caseworker to get signed up for TANF, but that is not required at this point. And honestly, I have to tell you, I hope some of these things will just stay in place even after this whole thing is over, because it is asinine and ridiculous that people have to come in person in the middle of a day with no childcare to access a critical program. I will stop ranting about that, but I just wanted to say it. They are continuing payment for Work First, Work Study, and community job payments. And they have filed an injunction to the new ABOD, or Able-Bodied Adults Without Disabilities. They have filed a waiver so that people who might not be able to access SNAP because they were not working but still able-bodied without dependents, able-bodied adults, without dependents, they have filed a waiver so that those folks will be able to continue receiving SNAP at this time. So those are the ones that are happening now, went into effect on Monday immediately. I should note that while these went into effect on Monday and were announced on a stakeholder phone call on Monday, DSHS was just starting that process also on Monday to get the word out to caseworkers on the street and working in the offices and on the phones. They also, so it's possible that it will continue to be a lag for a couple days as they get the word out to workers. They also noted that because they were moving things onto the phone, they were seeing an increased volume of calls, which is to be expected. But they are also, they have staff who have kids in the K-12 system who are struggling to get to work and do that. So they are navigating a few things. So all of these are great policies, but it does put a different sort of strain on a already strained system.
Understood. Marcy?
I have just two more. I just want to say I'm working on exempting people from the time limit and exempting ABD recipients from having to continue to go in and get there and apply for SSI and get certified. So I'm working on those things, and I will keep you all posted, and I will stop talking now.
Okay, that is all amazing and incredibly helpful. Wouldn't it be great if we didn't have to have a global pandemic to implement some of those very reasonable, necessary policies? I want to just acknowledge that it is 10:51 a.m. and we have extremely valuable and important information to share. Laura Lowe just put in the chat box, do we have a funny joke? Okay, seriously, in the survey that you will be getting from us after this, we are going to be asking you all for jokes, because yes, we do need a little bit of a breather. Jason is a specialist in bad dad jokes. I think his dad is. We do want to just take a breather. I want to say, I know some people may have to get off the call at 11, but I want to make sure that we let Michele Thomas speak next, and then we will keep the call going so that we can talk a little bit about the census, which still is somewhat happening and still is very important. But Marcy shared so much information there. Marcy's going to get us more information. We will share it with you and post it. And thank you to Poverty Action for their powerful work. The next person who's going to speak is Michele Thomas. And I want to say, just as we thank the people behind the scenes who do frontline work at shelters and people who drive our public buses, those are some of the people whom you may not necessarily see thanked publicly. Michele Thomas was described to me, and I know this to be true, as an unsung hero of our advocacy work. She has long and deep knowledge of the policy issues. She is a fierce advocate, and she is someone whom we know has the relationships with lawmakers and their staff that mean that we sometimes see negotiated policy wins that folks might not have really expected to be possible come up. So Michele, Michelle's via phone, audio only. Okay, got that. And I know there's so much for her to speak about, but I will trust her to be able to prioritize and of course also provide excellent follow-up information from the Washington Low Income Housing Alliance. Thank you so much, Michele. I think you're unmuted now. Please go ahead. Oops. Hillary and Sasha, I might need you to do something because Michele is unmuted for us.
Can you hear me?
Now we can hear you, Michele. Thank you.
Okay, great. Okay, sorry. Thanks. So, and thanks for that generous and kind introduction, Allison. So just, I want to just run through stuff really quickly. And I think, you know, at some future point, we can get into more details. But as Representative Macri said, this was an incredible session on the heels of two other incredible sessions. It's the biggest appropriation ever in a supplemental budget year, literally ever, both in terms of capital investments and operating investments. I really do want to give kudos to Representative Macri and CHOP and Governor Inslee, who set the table with, starting with Inslee's December budget appropriation. Also, just I want folks to know that Representative CHOP had a heads up that we might be seeing this extraordinary, unprecedented windfall that ended up getting us this significant appropriation. And in advance of that, he actually circulated a letter with House Democrats, with the vast majority of them signing on, saying that a significant portion, the vast majority of that unexpected windfall should go to affordable housing and homelessness. So he deserves thanks for that. Just really quickly, budget highlights that Representative Macri didn't already cover. Is one big one is the closing of the shelter penalty for ESA cash benefit programs, including ABD and TANF for refugee cash assistance and the pregnant women's assistance. So that was a $2.8 million total appropriation. Just a little note for those of you who are budget readers, you will note that the budget language actually excluded TANF, but the budget notes include it. And I've already talked to budget writers and they intended to include TANF. So all of those programs will no longer have the shelter penalty, and that's been paid for. The $15 million new appropriation for HEN is on the heels of last year's $14.5 million increase, which was the first increase ever to the program. So this is a total increase to HEN over the biennium of $30 million. The $15 million new increase this year in this budget is a 20% increase to HEN. So even though it was less than what we had seen in both the House and Senate initial budget proposals, a 20% increase to HEN in this supplemental year is unprecedented. We will be working next session to ensure that this is the new baseline funding. So, for example, when the biennial budget comes out next year, we will work to make sure that this new $15 million is included in that baseline. And so it will be the new total biennial amount moving forward. Additionally, there's some really important affordable housing dollars that were included in the budget. There was a new $40 million for the Housing Trust Fund that's fully competitive to try to address the backlog of affordable housing needs across Washington state. I'm also really proud because we got a new $10 million for a new fund to preserve currently affordable housing that's at risk of being lost. So similar to the SSI pilot, we intend for this to be a new program that we will continue to build on moving forward. This is going to save a lot of the at-risk currently rent-restricted housing across Washington state, such as USDA properties that are being put up for sale. If they are sold to somebody who is not a nonprofit or a public housing authority that intends to continue the use restrictions, that housing will be lost. This is significant for a lot of different types of housing, but particularly USDA properties, which is housing for seniors and people with disabilities in more rural areas. King County has a building in North Bend, for example, that's currently being sold. Luckily, a local senior center stepped in to purchase that one to save it, so the tenants will not be displaced. We will continue to maintain it as an asset for our communities. They got guidance from King County Housing Authority how to do that. Those are the types of projects that are going to be saved with this new money. A quick note in the budget about our coronavirus funds, though, and appropriations that were made to Commerce. As Representative Macri mentioned, some of the money that was actually appropriated to the Department of Commerce for homelessness is currently being used for the coronavirus response. That's concerning if that is not corrected over the long term. I think they needed flexibility to step into this unprecedented crisis. But what we were hoping for and what we were watching very closely is to ensure that that money is backfilled. So the $30 million that Commerce has gotten out the door for housing grants, $10 million of that comes from the COVID dollars from the budget stabilization account, sometimes referred to as the rainy day fund, but $20 million is from Commerce's operating budget that was supposed to solve our homelessness crisis pre-COVID. So just note that the Housing Alliance is watching this closely, and we will be working hard to make sure that those funds are repaid. Really quickly, in terms of bills, all bills that were passed, and again, this was unprecedented session for the amount of bills we were able to pass in a short period of time. It was a short session. All the bills will go into effect on June 11th, unless otherwise noted. One of those bills is House Bill 1694 by Representative Morgan. This is the installment payment plan bill. Once this goes into effect on June 11th, landlords will be required to accept installment payment plans if a tenant requests it. We were able to improve this bill in the Senate thanks to Senator Mullet's help. In the Senate, we added the first statutory cap on fees in Washington state. So we were able to add a cap on holding fees. Landlords are, as of June 11th, will no longer be allowed to charge beyond 25% of the first month's rent for those holding fees that tenants are oftentimes required to put down when they apply for a unit. That's a huge win. Additionally, we were able to add a penalty for landlords, against landlords who don't abide by the law with Senator Mullet's help. So we can go into more details later, but if you are working with clients who are moving out of homelessness or who need to move, make sure that they know that they have the right to ask for these installment payment plans. There are some details you'll need to know. The Housing Alliance can be a resource, and we can get into the nuances of the bill, but it's a huge victory. I do also want to point out one other bill, 1590 by Representative Dolio. So this is the bill that allows the allows the 0.1% for affordable housing sales tax increase to be passed councilmanically. All counties have until September to first use the councilmanic authority. And by councilmanic, I mean a simple majority vote of the local elected lawmakers. This tax is either a county or city option. But if cities act before their counties, counties can still act, they just have to carve out the tax base of the cities. So I'm just putting this out there now for all of you who are advocates in King County. If King County does not first use this councilmanic authority by September, each city in King County can use that councilmanic authority to implement this tax, and all of the funds need to go towards affordable housing or behavioral health facilities that are accessible to people earning no more than 60% of the area median income, and it's a significant amount of money. The similar tax, the MID, that a lot of you will be familiar with, out of the counties, the 23 counties, I think it is statewide, that have implemented that, it's the same taxing authority, 1/10 of 1% sales tax. That brought in 2018 statewide $146 million. So if counties across the state and if big cities in particular across the state implement this authority, we could see a lot more money for affordable housing and mental health facilities. So I think I'll leave it at that. There's a lot more to say about the session. The Housing Alliance will be sending out soon an action alert to thank our lawmakers. After lawmakers have taken these extraordinary actions, thanking them for their work is really, really, really critical. So please stay tuned for that. Skitch, maybe you can also send that to your folks in case people aren't both on our list, because those thank yous go really, really far, and we have a lot of champions. One other just quick note, the reason we have a lot of champions is because we're electing them. If you're not already familiar with the Housing Alliance Action Fund, our sister C4 organization, I highly recommend you look into that, because we need to continue to back and support and elect housing champions across Washington state so we can continue to make this progress. Thank you to everybody for your work.
Thank you so much, Michelle. One thing before we shift to our next presenter, Sarah Brady, and I'll let Hillary introduce Sarah. Michelle, we've seen at the national level, Congress authorized an emergency response package for COVID-19 that did not include dedicated resources for addressing this disease within populations experiencing homelessness, nor did it specifically address housing needs. So if there is a special session in our state to address this crisis with additional resources, I'm guessing that we will need to do parallel advocacy at the state to the advocacy that the National Low Income Housing Coalition and the National Alliance to End Homelessness are now mobilizing all of us for at the federal level, namely to make sure that our folks are not just not left out, but are put at the heart of emergency response and recovery packages. Quite honestly, we're not in recovery mode. we need the emergency response to be more focused. So do you have any words that you want to say to the 99 or so advocates or soon to be advocates on this call attending our meeting about what advocacy at the state level might look like in the coming weeks and months?
Yeah, thank you. I meant to also comment on that. So the National Low Income Housing Coalition is working still. There's going to be another package coming out, and they hope to get the details together by the end of this week. And they're explicitly working to make sure that it includes the things, Allison, that you just noted that were not included in the relief package. So if you're not already hooked into the National Low Income Housing Coalition, I highly recommend you get involved with them. They are looking for information from each state about what's going on and where there is a lack of funds, so they can advocate for that at the federal level. In terms of the moratorium that just got passed, we expect more announcements to be coming from Governor Inslee. The moratorium on evictions was only 30 days. We will be pushing to make sure that that's extended. As you state, Allison, we're pretty dang positive we're not going to be through this in 30 days, and that the economic impacts are going to be significant and long. We're also going to be, as Xochitl noted, advocating to add late fees to that moratorium. And we just had a call this morning with the Department of Commerce talking about rental assistance. So whether or not they need a special session to get rental assistance flowing I don't think they do, because they have a lot of money that is unspent out of the budget stabilization account alone. Okay. And so rental assistance is definitely a conversation that's already started and that's on the table. And we will be working to get that. I think that local government, though, so a lot of you advocate at the local government level, I think we need to still ask local governments to quickly step in to provide rental assistance as well, because whatever the state is able to provide, it's just, I can't see it being enough unless they pull a lot more money out of that budget stabilization account, which will indeed require a special session. I think the state has money though, and we can get rental assistance flowing before any special session happens.
Great. Thank you very, very much, Michele. I know we're a little over time here, but I think we still have almost everyone on the phone. Really appreciate that, Michele. We have one more wonderful win to celebrate in the legislative session, and I'll let Hillary introduce Sarah, and then we'll take a very short little delightful break while we share information about, I believe, the coalition's new mascot, Edgar Allan Crow. And then Jason is going to share information with two other guests who I think are still on the call around Census 2020. So we'll aim to wrap up by 11:30. Hillary and Sarah, over to you.
Yep, thank you so much. And I want to say we will make sure to send out a follow-up email that will include some of the information that has a link of where you can see some of the legislative session wins in a summary that the Housing Alliance put out, as well as that thank you message. So I want to turn it over really briefly to Sarah Brady, who is with the Policy and Advocacy Manager with Child Care Resources and worked very, very hard this session to pass a wonderful bill around making sure that child care is accessible to families who are experiencing homelessness. So take it away, Sarah, and I will unmute you. There you go.
Great, thanks. Listen, I'll be very quick. House Bill 2456 was the bill to expand access to childcare for families experiencing homelessness. And we were looking at what's called the homeless grace period. And this is our state has had historically 4 months where families that are experiencing homelessness can have access to the Working Connections Child Care Subsidy to get help paying for childcare. And of course, 4 months, our data shows, and we all know, it was not enough time for families to be able to stabilize the situation and meet the requirements for Working Connections, specifically the work requirement. We were even finding that 4 months wasn't enough time to find childcare because it's there's such a scarcity of it as there is, and it's even harder for people who might need support with developmental disabilities or non-standard hours, the flexibility that families need. So really, it was a very limited window. The bill had a lot of support going out the door, but it hit some major barriers in the Senate at the Ways and Means Committee. I think a lot of this was like the messaging of parent accountability and legislators feeling like 12 months was too much flexibility. But we were at the very last minute able to get it passed the Senate at 6 months, but in conference, we were able to get the final bill be the bill that passed the House at 12 months. So starting July 1st, we have families that are experiencing homelessness are eligible for child care assistance. It's called the Homeless Grace Period. A lot of families don't know that they qualify, so it's good to ask for it and know to ask for it. It's called the Homeless Grace Period, and they can call our team at Child Care Resources to get help navigating that, and they'll have access to 12 months of childcare. If a family is currently on the Homeless Grace Period, they're going to roll on to a full 12 months. Yeah, so July 1st is the implementation date, but they are counting the current caseload for that. So that's really great news. And I want to thank you all so much because it took a lot of mobilization, and I was really excited to have the opportunity for early learning and homelessness advocates, housing advocates, kind of this cross-sector effort was really exciting because we don't talk enough about the needs of really young kids who are experiencing homelessness and aren't old enough to be in school during the day and need a lot of support.
Great. Thank you so much, Sharon. I just want to thank you and your team. I know, like you just mentioned, and everyone should know the work that was done to make sure by the House members as well, to make sure that the bill got the 12-month grace period was some extraordinary work in the final days of session. I just want to, I believe this is true, but if people currently need the grace period, it does exist for 4 months. So people can call Child Care Resources and ask for help getting the grace period at this point, and then it will expand to 12 months on July 1st. Is that correct?
That's correct. Yeah.
Great. Thank you so much, Sarah.
And if I could just mention too, to consider childcare resources a resource during COVID, our whole organization is restructuring to respond to COVID right now. And our family call center is now a COVID childcare response. We are working with all of the pop-up childcare that's being offered in the school districts and YMCAs, and trying to be like the network hub for the needs of families and the places where we can find it. So call on childcare resources.
That's really wonderful to know. We may line you up for a future call because childcare and how to, you know, do some really good work to support kids and their family members in this time are very important. So thank you so much for telling us that, Sarah, and congratulations. I also want to give a shout out to Hillary, who tracked that issue so carefully.
Yes, thank you, Hillary.
And the folks at HopeLink, who were part of a wonderful, wonderful special advocacy session. And they were so great at articulating and finding family members to speak about why this mattered. So that's really a fantastic, fantastic win for our community.
Yes.
Thank you, Sarah.
Thank you all. Really.
So, those of you who have screens, you can see Edgar Allan Crow with Christine. I just cannot believe this. That is an extremely beautiful bird. He is, we're going to get a picture of him and show him to everybody in the follow-up email. But now we have Jason. I'm going to let Jason take the seat that I'm in right now so he can be a little closer to you and talk about the census, which is actually both happening and delayed. So I'll let Jason take over.
Thank you, Allison. Hello, everyone. So once upon a time, 4 weeks ago, our March membership meeting was going to be the first meeting that we were going to hold in our new space, the Rainier Arts Community Center in Columbia City. And our main topic was going to be the 2020 census, because at that time, what felt like lifetimes ago, that seemed like the most pressing and current need in our community. Obviously, that is no longer true. However, the census is still moving forward in some configuration, and it is still an extremely important event in our community. Very quick recap. I'm sure you're all experts on the census at this point, but this is a once every 10-year count of everyone in the country as mandated by the Constitution. The importance are data, dollars, and democracy. The census determines where roughly $17 billion worth of funding gets directed to in our community, from the number of Section 8 vouchers issued to housing authorities to the size of Medicaid block grants and everything else in between. The results of the census also determine where electoral boundaries get drawn, everything from congressional districts on down to where city council lines are drawn are determined by the census. And census information determines a lot of decision making. When businesses are looking to expand, they look at census data to figure out where their new store should be. When transit authorities or healthcare authorities are looking at expanding bus stops and outpatient clinics, they're looking at census data to determine where those resources get directed to. So, you know, this is something that will determine for the next 10 years the amount and configuration of resources that our community gets. Even a relatively small undercount will result in pretty big divestments from our community. So this is something that we still need to be making a priority of helping the folks that we work with complete in order that everyone gets counted accurately. Now, before all this started, the census had an operation in which they call group quarters enumeration, which is an effort to count people who do not live in a traditional residential address. Those with traditional residential addresses have all been mailed information by the Census Bureau, encouraging them to fill out the form either online or over the phone. If you all have received those, please do that as quickly as possible, obviously. For those who maybe don't live in a traditional address, be they in student housing, a mental health facility, jails and prisons, or shelters or transitional housing programs, that is being covered through something called group quarters enumeration. Previously, this was going to happen through a combination of census staff going to some of these sites and conducting the survey in person, as well as contacting site administrators to submit demographic data on the people that are currently residing there. The Census Bureau has been doing their best, I think, to respond to this situation and is trying to keep this operation going forward while also honoring the need for social distancing. Where things currently stand was on Tuesday, they announced that they would still be moving forward with their group quarter service-based enumeration on the same timeframe as previously established, March 30th, 31st, and April 1st. On Wednesday, they announced that they will be suspending all field operations for the census. Now, what does that mean for staff at frontline agencies such as mobile meal programs and day centers? Well, you may still be contacted by Census Bureau employees to gather this information from you. We will update you all as soon as we have clearer guidance on this. But I think the main takeaway from all this is that we need to be taking even more ownership than ever before in making sure that the people that we work with get counted in the census. Again, the main two methods for this are online as well as over the phone. We will be sharing both the URL link as well as the toll-free hotline phone number for this in the follow-up email. If you have the ability to have your folks complete the census with you, be it in a client interview or in a day center setting, we do encourage you to do that. Obviously follow the hygiene guidance being offered by King County Public Health, wipe down your screen, make sure people are washing hands as much as beforehand. As much as possible, being able to help folks fill out the census remotely is going to help this whole operation run as smoothly as possible in whatever form it takes going into the future. Now, we're lucky enough to be joined by a couple of folks who have been doing some really excellent work in the community around this topic. So first, I want to throw things over to Maya Manis. Maya is with the Urban League and has been doing some great work with We Count King County. Maya, do you want to give us a sense of where things currently stand on your end with it?
Hang on, Maya, because there you go. There you go.
Okay. Hi. Hi, everyone. So yes, so there are new updates with We Count King County website. So if you want to know how to switch your messaging or add stuff on your social media or newsletters or whatnot, there is a new toolkit for COVID responses. But I just want to reiterate and really highlight what Jason was saying, that we now need to rely more on case managers and more on making sure that we get those who are experiencing homelessness or sleeping in their vehicles or whatnot counted for the 2020 census. Because right now there is no field operations updates, and there might be eliminating non-response follow-ups, especially like early non-response follow-ups. That is still something that they're trying to see where this pandemic and how it grows. But that's something to know, that for us to make sure we get an accurate count, that we need to really rely on a community and whatnot. So the Urban League of Metropolitan Seattle is trying to think of new and different ways to make sure people are getting counted. It's really easy to do it over with their own cell phone. So we're trying to think of different ways to give them like a hygiene kit, and in the hygiene kit say like fill out the 2020 census. It'll take like 10 minutes and whatnot, even if you don't have a household address or whatnot, and whatnot. So we're just trying to think of different ways to try to make sure people are getting counted, because it's now more vital than ever to make sure those who are most vulnerable or are usually undercounted it's going to be even more of an undercount this time. So trying to just think of different ways. In 2 days, you will start seeing response rates and whatnot. If your organization would like any like information to add into your newsletter, or want something more information given to your like shelters or day centers, you can definitely reach out to me, and I'll be happy to help as much as we can, because that is basically what I've been doing since being in lockdown, is to make sure we have an accurate count.
Wonderful. Thank you so much, Maya.
Mm-hmm.
As Maya mentioned, there is a COVID census toolkit that is available through We Count King County that we will be sharing with you all after the meeting. And then we also have another fantastic community partner who has joined us to speak briefly on this, Debbie Carlson with LGBTQ Allyship. Debbie is one of many people involved with an organization called Queer the Census, which is trying to make sure that LGBTQ people, which are one of the demographic groups oftentimes historically undercounted, have access to the survey and get themselves counted. Debbie, do you want to share a little bit about what your organization has been doing to adapt to this new environment?
For having me on the line. One of the things that we've been doing is we've created a website that offers frequently asked questions of our community around challenges and confusion, and how the census actually doesn't represent us and how to navigate that. And it's called queerthecensuswa.org. We're also we've been out in community doing trainings to providers, government officials, in our own community, and advocates around how to navigate and strategies how to navigate the census, and just general outreach. The coalition itself is a 15-member coalition, and we're all working together as LGBTQ-led organizations to outreach within our community, particularly in South King County and North King County, but really statewide. One of the things that we are trying to field is that, and this is true within the homeless population, is that trans and gender nonconforming people will not be counted at all. And so this is really discouraging for many people, especially some of the most marginalized in our community. So it's important to let folks know that they will, around the gender question, or I think you have to identify one of two sexes, that we're encouraging people, if they want to fill out that question, is to fill out the sex that they most gravitate to, to use your name, your preferred name. There will not be, the census will not be checking on that, even if it's different than what your legal name is on different legal documents. So we're trying to just educate people around some of the challenges, and that the Census Bureau will not be checking those documents around, is particularly around safety for a lot of LGBTQ folks. And then also for lesbian, gay, bisexual, queer people, there is one question where we can be counted, and that's around marriage status or marital status. And there is a question around same-sex domestic partners or married partners, and there is no limitation on your relationship. Especially for homeless folks, there's many ways that we define our relationships. If you've been with someone for a couple weeks, couple months, and you consider them your partner, that's the only way that we actually are counted. And so we want to really emphasize that, so that more of us can be counted within all the different populations, particularly, for example, homeless populations, so that we know who we are out there and the needs that we have. It's also really important, and I know that this is something that a lot of educators are emphasizing, is that LGBTQ families with children, that even if they're foster children, that they be counted, and that if you have chosen family that you are living with, you can identify them in multiple ways. One suggestion is other relative, so that, again, the relationships that we have that really support us in our survival are also counted as well. So those are just a few tips. More tips are available on our website. And thank you so much for the time.
Thank you, Debbie. And I gather that for those looking for additional technical assistance, you have an event coming up on April 1st for more information.
I'm sorry, what was that? Sorry. I thought you were making a general statement.
Just very briefly, can you mention your event on April 1st?
Yes, so we have been doing community events as well to educate our community, and we've changed a community event, an April 1st community event, to a virtual forum where, and you can get this on the website and as well as on Facebook. It will be happening from 5 to 7. We'll have just general information around how to navigate best the census, as well as we'll also have some officials or experts talking about COVID-19 resources and responses, particularly for the LGBTQ+ community.
Fantastic, and we'll be sharing that in our follow-up. Thank you so much, Debbie.
Thank you.
So we just have a few minutes here, and I'm going to wrap us all up. Lots and lots of resources were shared. Please give us a little bit of time to pull all of that together and send you a follow-up. We've learned a lot just from hosting a call this big. We maxed out, as I said, with 99 people, and there's still over 70 on the call. So we know this is an indication that you needed the information, and we're happy to bring it to you, but we also want to try to make sure we're doing it well. Oh, look at that little hand clap emoji. Catherine Hendrickson teaches us all the time the communication tools. So we really, really are so happy that we got a chance to have this meeting, even though it's not in person. It feels like we are still a coalition community, and maybe this makes it a little easier for some of our members to join us than an in-person meeting even does. We are going to work with folks to make sure that census information is available even as programs are shifting and changing. Stand by, because there will be information about how to access rental assistance. There will be information about how to press for the 30-day state eviction moratorium to be made stronger and longer. Stand by, because there is incredibly important work for us to do to make sure that our federal government response matches our need. And also, I'm sorry to end on this note, but I want to say it. We actually probably know that we have not seen the worst of this. And there are some really hard times that are coming our way. So more than ever, we really need to be good organizers, good neighbors, good partners, continue to lift up the terrific work that everyday people were doing before a pandemic came our way, and continue to make sure that we are pressing for really good policies that include, that don't exclude, but that are customized to the needs of various constituencies and people who are hardest hit. We want to thank all of you so much. Please do put your emails in the chat box if you haven't already. Next time we do this, we will have a registration so that we don't clog up the chat box. And we will be following up. Follow us on social media. Twitter and Facebook are fairly active. Let us know if you have suggestions for us about how to do this better the next time we do it. We meet the third Thursday of every month. We're going to stick to that schedule. And we realize that because things are changing so fast, we may add additional online meetings. For those of you on the phone who are coalition member organizations, I am convening a regular Friday afternoon call for executive directors and senior leaders. We know that these are times that might make it a little hard to put membership dues at the top of your expenditure list. So we're not worried about that. So if your organization hasn't paid membership dues, but you really see yourselves as a member of the coalition, get a hold of Jason, Hillary, or me, and we will work with you. And we want to thank you all so much. Hope that you spread the word on these resources and continue doing your good work and keep us informed as you are running into new issues, emergent issues. We're not going to be able to answer every single question that got raised on chat, but we are going to go through them and see where there are some groupings that we will do our best to gather information about and address. Thank you all so much. I think it is now 11:31, so that was a really long meeting, but thank you and have a really good rest of your day. Wash your hands, stop touching your face, clean your phones, pet your cats, thank your crows, and we will be in good contact. Thank you all very much.